Method of operation. Take out the stapler and reloading unit. Reloading unit. Inserts the roux into the stapler shaft. Push in and twist clockwise with an audible click confirms it is locked into place. Rotate to align. Key precautions loading the reloading units. Take off the yellow blade protective cover. Key precautions protective cover removal. Adjust the steering wrench or rotary switch to make the jaw in a proper position. Squeeze the firing handle completely to close the jaws and securely clamp the tissue. Compress the tissue for 15 to 20 seconds. Push the green safety button before starting the firing process. Squeeze the firing handle sequentially until the handle locks. Pull the black return knob back to release, opening the jaw. One firing is complete. Key precautions: tissue placement in the jaw. Key precautions: pull to open lever and clearing the stapler. Press and hold the unload button. Turn the cartridge anti-clockwise to unlock and release it from the shaft. Key precautions handling the unload button.